I'm Laura Fossey-Name, and I'm chair of the Women's Philanthropy Initiative at Georgia State University, and we are co-sponsors of this particular series, along with the Office of the Provost. And this is our third year in the series, so for those of you who are new to attending, I say welcome. You're in for an absolute treat, especially after coming away from our Thanksgiving tables and our Cyber Mondays, and here for some intellectual curiosity and pursuit. You will, if you look at the slate of our featured speakers, we are incredibly grateful that they are stellar and strong, and they come from all across the university in the various disciplines. Each one of them is just, quite honestly, just rocking it in the classroom and doing great things in their research, but really making an incredible and inspiring impact on our communities, both here in the Atlanta metro, around the nation, and of course across the globe. And this particular topic today really speaks to that. And the third reason that I'm particularly excited about this series is that it brings together all of us in the room, that we come from different hats that we wear as students, as faculty, as alumni, but really from, like I said, all across the various disciplines. And this gives us a really unique opportunity that we don't have when we stay within our offices and our hallways to reach out to other units around campus and begin a dialogue and have a conversation around an important subject. So I'm really delighted about that part. And I have to say on a personal level that today's topic, when we focus on public health, it's near and dear to my heart. When I've lived in about 11 states, and when I moved to the state of Minnesota, I was utterly astounded that ordinary citizens, honestly, actually knew by name and by face who their commissioner of public health was for the state of Minnesota. And I was shocked. That was really very eye-opening. But public health really, on a personal level, came on my radar screen when I read a book by Tracy Kidder called Mountains Beyond Mountains. And it's a story of Paul Farmer and his public health work, beginning in Haiti and then fanning out around the globe. And I think that bestseller really brought home to an average American, if they did pick up the book, the possibilities about public health and what it does for our communities and our globe. Okay, so without further ado, I'd like to bring up to the podium, if you'll help me welcome our provost, Risa Palm, who's been with us for 8 years, and she's here inspiring us every day on campus. Risa, if you'll please introduce our speaker.
I'm very, very pleased to introduce today's speaker, Monica Swahn. She has been a faculty member at Georgia State since 2007. She was Associate Dean for Research in what was formerly the College of Health and Human Sciences, and she's also served as the Associate Vice President for Research for the university. She's currently professor in the Division of Epidemiology and Biostatistics and the Partnership for Urban Health Research. Before coming to GSU, Monica worked at the Centers for Disease Control in the National Center for Chronic Disease Prevention and Health Promotion, and she also spent a year as a fellow in the Office of the Chief Science Officer, Office of the Director at the CDC. Currently also, she is a Fulbright Scholar for the Sub-Saharan HIV program and assigned to the School of Public Health at Makerere University in Uganda. Her academic degrees are from the University of Pittsburgh, all 3 degrees, and she received an MPH and also a PhD in epidemiology. She's the author, if you ever care to look at her vita, of numerous publications, but 3 rather interesting topics that are related to her topic today. 1, high-risk behaviors among youth in the slums of Kampala, Uganda, alcohol marketing and drunkenness among students in the Philippines, and fighting self-harm and suicide attempts among urban students in high risk in U.S. cities. Clearly, Monica is not only a person who is contributing to our university, to our students, to our academic reputation, but also to the well-being of people throughout the world. And we certainly count her as one of our truly distinguished women faculty members at Georgia State. Her title for today is Alcohol Cheaper Than Water, Conundrums Facing Public Health Abroad and at Home. Please help me welcome Dr. Monica Swahn.
Wow. I'm good, right? Thank you so much for that kind introduction. I got a little speechless there, but thank you so much. And thank you to all of you for coming and for our First Lady of Voice in Aid for organizing this Women's Series as a way to showcase what we are working on and really spark a conversation about interesting and controversial topics. So I struggled a little bit. All right. Chris, it was working beautifully a moment ago, and now it's not working. All right, so in preparation for this talk, I was told I only had 15 minutes, and in reality, I would love to talk to you for hours, right? This is my favorite, some of my favorite topics that I'm going to cover. But I'm also an epidemiologist, which means that I'm really good with numbers, and I love trends and data, and that's what I'm out in the world collecting data and analyzing surveys. But for a talk like this, that's not really, I think, what you were expecting and hoping to hear. So it's going to be more like a TED-type talk. So that's the interesting title that we have, Alcohol Cheaper Than Water, Conundrums Facing Public Health Abroad and at Home. Thank you, Chris. And so without further ado, just want to share a little bit about how complicated all of this is. Also want to share with you my passion for this. And in trying to select a topic that we were going to cover, I often get the questions like, well, why are you in Uganda? Why are you working in Africa? Why are you doing research in the Philippines? In countries where the situation are so grim, like, well, is there hope? You know, will you ever make a difference? So as of last Thursday, I revised the topic. Well, the title is the same, but I revised the topic because I wanted to sort of share an uplifting story, something that gives hope and something that actually shows that we can have an impact. So it's all complicated, but you get the 15-minute version. That's all I have. So let's begin with a recent success. So last Thursday, Thanksgiving in the U.S., most of us are taking a moment to reflect and to think about the things we are grateful and thankful for. And I had some extra time with my children, who I hadn't seen that much because I've been in Uganda for the last 2 months. But I woke up and I started looking at the social media and the websites. And what did I see? I was so excited. The Ugandan government had decided to ban something called alcohol in sachets. They look like this. Small little plastic bags, and I have another slide on it. But anyway, this is a huge thing that we have worked on for a long time. So the ban is going to take effect starting next year, September 2017. So you say, what are the sachets? And so I held out my little prompt a little too soon. But anyway, so they're little plastic bags like this, and these are actual big ones. These are 100 milliliters. They come as small as 25 and 50 milliliters. So imagine like a quarter of this, right? So that's how they sell alcohol. And so you wonder, why is that important? Why do we care? We all have different ways of selling alcohol. Well, we find that youth really prefer buying alcohol that way. They're easy to hide. If you don't want to show anybody you're drinking, you can stick them in your pockets. So not only are they cheap and they're easy to hide, but there's no minimum unit pricing. So without going into too much about the policy environment, in most countries, there's a minimum price you have to pay for 1 unit serving. Not there. So in essence, alcohol is cheaper than water. You can get these for just a few cents. And so that's why, even in the slums where I work, these are very accessible and available. And so we have worked for years to try to ban these sachets. But let me tell you from the beginning why I started working in Uganda. So several years ago, about 1999 or 2010, started meeting a gentleman at a conference, at an alcohol epidemiology conference. People like myself who really like looking at survey data, looking at trends, evaluating the impact of policy changes and interventions. And he came to this meeting, a Ugandan man who isn't used to necessarily be presenting in research settings. And he talked about the plight of alcohol and the problem in Uganda. And unfortunately, not many people listened. I was stunned, being trained in alcohol epidemiology, that I myself had really no idea about the problem of alcohol use in sub-Saharan Africa, really. It was not talked about. But since then, we have met multiple times. I was very fortunate to get an internal grant from the university to actually go there and start this research portfolio, just check out the environment and actually do some preliminary work. So fantastic opportunity. But what I'm going to talk about all reflects teamwork. And so Rogers is the gentleman on your very left, who I had been working with now for some 6 years. When I started working with him, he ran an NGO, or a non-government organization, in Kampala, serving about a couple hundred youth a month. A couple hundred youth a month that he served, trained in vocational training, etc. Now, with the growth that he has seen, he serves several thousand a day. And so that impact in and of itself, in terms of providing services to youth in the slums, is a really powerful one. But he's also an advocate for alcohol control and prevention, as he is for many other health topics. So I'm not an advocate, I'm a researcher, but we work as a team to really change the environment. So Uganda has been in the media for a couple of different reasons the last couple of years. But the one that really set off the whole alcohol debate was a WHO report in 2004 that claimed or reported that Uganda had the highest per capita consumption of alcohol in the world. Highest alcohol per capita consumption in the world. Now, they have since revised that estimate, and it's exactly that, it's an estimate, because the surveillance system or the monitoring tools that we have in other countries are not nearly as sophisticated as we have in the US. The drinking problem in Uganda is also exacerbated because so much of the alcohol they drink is what we refer to as moonshine. They call it waraji, something else. But that's very difficult to measure. Very difficult to measure. There was also a documentary filmmaker who was there talking about Uganda being the drunkest place on earth. No country really want to have that kind of heading, right? WHO also now reports Uganda leading alcohol consumption in Eastern Africa, and so a lot of reasons coming together why there's a big drinking problem. So what have I done there? Well, I have done a lot of research over the last 6 years trying to document the situation in Kampala, which is the capital in Uganda. There are high levels of drinking and high levels of alcohol marketing, and I'll show you a couple pictures of that so you can get a context. But when we study the kids who live in the slums, even the young, the 12 to 18-year-olds who live in the poorest of circumstances, we find that some 40% of the drinkers are already what we can classify as problem drinkers. That means that they're not only drinking excessively, but they're also drinking to the point that they experience harm. So huge. We also find that children and youth under 18 years of age, and 18 is the legal drinking age in Uganda, are exposed to lots of alcohol marketing. They're not shielded in a way that we try to shield our children here or in other developing countries. I'm just going to show you like 3 different ads just to kind of give you the context for what the marketing looks like. This brand, Crazy Cock, speaks for itself. Seriously, crazy is even part of their slogan. You see the rooster to your left, and any of you who might have been working in health communication or marketing knows that we shall not advertise these type of products to children, but this is what the children see. When we ask them, what kind of ads do you remember seeing? They always mention this one because of the rooster. So it's a very memorable one. In terms of the scale of the alcohol marketing, it's also very difficult to convey without showing pictures. This one, I don't even know what the formal word is because I've never seen them in other countries, but it's a big ad that spans a 2-lane, not a highway, but a busy road. And so the scale of these ads are just really, really enormous. But then there's a third layer to that, and that is in most places, in most countries that have some kind of alcohol control policy, you cannot put ads where children spend a lot of times, like kindergarten and schools. So that's what this picture shows. This green ad, or the Tusker ad, is actually blocking the kindergarten sign right behind it. So this is what children see all the time. So what have we done so far? Well, we have done a lot of research and dissemination of that research. I've been fortunate enough to have NIH funding to do a lot of surveys and focus groups, stakeholder interviews, and even environmental scans, where we have actually walked around and picked up these sachets to try to look at environmental differences in different communities. But most of what I do there, too, is really summarizing evidence. Again, I'm working in Uganda because alcohol epidemiologists do not really exist there. This is a unique sort of skill and training that I have that they really need. And so summarizing the evidence and making evidence-based recommendations is really that missing gap to make a big change. So briefing decision makers, including members of parliament, has been a really big part of what I'm doing. And the Ministry of Trade has been an incredibly important partner in all of this. Of course, we do a lot of research, have to publish our research. That's part of being an academician, but it's also part of generating that evidence, right, that goes into these briefings that we need to pursue. We have also worked on a slum rating scale to try to look at what we call the structural drivers of alcohol use and how alcohol is linked to violence and HIV/AIDS. And it's sort of a new concept, but we're really trying to look at the built environment and the structural, the environmental differences across these different communities to try to see if we can learn and actually do a sort of a quicker assessment of communities rather than doing surveys of individuals who live there. And part of that, again, was to walk around and collect these empty sachets that people have thrown away just as a marker for the type of alcohol use in the different communities. So the biggest briefing or the biggest sort of policy push that we had was about 1.5 years ago when we decided to really work with the Ministry of Trade. And you can say, well, hey, I'm a health person. Why would I even go deal with the Ministry of Trade? That might seem like a far-fetched idea. But Ministry of Trade in most countries is actually a regulatory agency. They actually can implement change pretty quickly. And when it comes to selling and producing or the packaging and selling of products, it's something that they have total control over, pretty much. So about 1.5 years ago, we scheduled several meetings with the Ministry of Trade, and we talked to them and shared numbers and data about the problem of alcohol use in Uganda, something that they had never really even actually talked about. And we made a couple recommendations, but focused on those that we thought could be easier wins, right? So banning these sachets was our first priority. That's something that they had within their purview to do. Regulating alcohol ads also, we've not seen any movement on that yet. But also licensing, time and location of sales. These are things that we take for granted because we have a relatively strong alcohol control policy in the US, North America, Europe, Australia. But in many countries, these things aren't in place yet. And so we are really, really, obviously super excited. We'll be celebrating this win with the sachets for a long time. But the work continues, right? And so it's all about, right now they're debating a larger alcohol control bill that will regulate advertisement, will regulate a lot of different things. But it's going to be a long process, just as it is here. But one of the things that I've been fortunate about, and the provost highlighted this too, as a Fulbright scholar, I have now the opportunity to work with them, work with the university, work with the government, work with many community-based organizations to build interest in alcohol research, to disseminate, to help train university students, and to work with these community-based organizations to really try to make a difference and grow these partnerships. And of course, as a Georgia State faculty member, I'm also writing research grants. We're hoping to write a really big one to do an alcohol counter-marketing campaign in Kampala in a couple years, and so fingers crossed on that one. But we're also looking at different patterns and trends to target other types of interventions. And when I was thinking about why is it that my work in Uganda is relative or important to my work here, one topic stood out in particular, and also because this was Women Inspire series, it kind of made a lot of sense. It's really looking at the emerging trends of women drinking. And I want to share a little bit with you on that. The drinking context for women relative to men in most countries is such that in most countries, if they're drinking, men tend to drink, be more often to be a drinker and also to drink more. And that's what we see in Uganda as well, where the male drinkers tend to outnumber women 3-1. But when we look at the research that we have recently done with the youth in the slums, we actually find that over 40% of those youth who are drinking are actually women. And so we're wondering about this changing culture shift in these very poor urban areas. And interestingly, too, in the U.S., patterns have been changing for quite some time, too. And there's been an interesting debate about that. A recent report talked about that men have generally outpaced women in how much and how often they drink, but the gap is really closing as women's drinking are increasing. So there are a couple of reasons we're speculating as to why the drinking among women are shifting, not only in the U.S., but elsewhere. And so first of all, there's massive industry targeting for women to drinking as new alcohol consumers because they have tended to drink less in the past. There are also new alcohol products on the market, like the ones that seem sweeter, more colorful, and with more of a feminine appeal, and marketing directly for women's needs, like skinny, low-calorie margaritas. Actually, how many of you have seen those? I mean, I have. I've even drunk some. Maybe I shouldn't have said that. But so all of us have come across this. We see it, and on an individual level, it might seem fun, or it might seem cute, or it's sort of interesting. But when we're starting putting this together in the aggregate, there's another picture emerging. So we're really at a transition point where norms and culture are shifting around drinking and when it's okay to drink. In particular, this alcohol as mommy juice. Have you heard of alcohol as mommy juice? Well, I see it a lot on Facebook, social media, on the internet, and I have friends who refer to it. And again, at an individual level, it sounds cute. It's kind of like, oh, it's okay. But at an aggregate level, it speaks volumes to how we're changing the culture. Here's just some pictures that I found the other day, just to give some examples. And I said, if you come across this, you might laugh. It's kind of funny, right? That we've all seen this. But if you take a moment to look at the messages that we're portraying, mama needs a drink, or I need a man moment, but I was able to open the whiskey bottle by myself. Independence. Mommy juice, you can't see the little text on that green one, but it talks about diapers, piano lessons, soccer, and it's really about the multiple roles we have as women. And so have some alcohol. It will make you feel better, make you more accomplished and not so stressed out. How about a day without wine? It's like, just kidding. I have no idea. So daily drinking is fine. How about starting to drinking before 8 a.m.? So these are really challenging the norms that we've had, sort of the social informal controls about when it's okay to be drinking and under what circumstances. So I just wanted to close with just make a reference to this book. And sparking a conversation perhaps too about women's drinking. So Ann Dowsett Johnston, who is an author, journalist, former academician in Canada, wrote this book about 2 years ago talking about drink, the intimate relationship between women and alcohol. She's a really, really interesting woman. And in this book, she talks about her own recovery from alcoholism. But she also interweaves her stories with the latest research, the best and the brightest, the real research. And she's really talking about this precipitous rise in risky drinking among women and girls, and talk about some of the points that I've made here. It's really a pleasant book. But anyway, so my thought to all of you in terms of women and drinking, I encourage you to look at it, look at the ads, and think about it, what we can do as women to support each other and our multiple roles. And I'd like to hear your reactions on that. Again, I'm a mom of 3 sons, and I promised I wasn't going to do this, Christopher, but as a mother of 3 children, I'm always very concerned about how we treat mothers and then sort of the cultural context for that. But thank you. That's all I had for today. Thank you.
I'd like to open up the floor to any questions. I think let's we do have a microphone here, and so let's use it so that we can all hear both the question and the answer. Don't be shy.
So with the ban of the alcohol, is this going to drive the market to underground sales? Is that any potential, what will happen to the people that are producing alcohol in the sachets? Will they drive it to underground sales now that they're banned? Is that a possibility? Do you have any idea?
So it's a really great question. So in essence, what's going to happen to the people now? Are they going to replace buying the sachet with something else? And what happens to the alcohol companies? Are they going to sell their products differently? And so I think a little bit of both. And I think maybe the larger context here is also that the alcohol environment is changing, right? So I didn't really mention much about this, but there's another alcohol control bill that is being reviewed at the Parliament that has many more restrictions about licensing and sales. And again, in these 15 minutes, couldn't get into all of that. So there's another sort of sensitivity to this. I'm hoping, too, that underage drinking is something that's going to be considered more seriously. The legal drinking age there is 18, but pretty much anybody can go and buy alcohol. So if this ban of sachets actually co-occur with a more stricter enforcement of the underage drinking, we will have a huge impact. I think we'll have an impact just with this, just because, again, it's going to be harder to buy these very, very cheap, you have to buy larger bottles. So I think there will be some shift in patterns, in particular for the youth and the among the most poor. In terms of the distributors, I think they will just package it differently. They'll just package it in the larger bottles, which most of them already have. But great question, thank you.
Good morning. Do you have some sense of the age of onset of these? Like, when are they starting to drink?
Oh, that's one of my favorite questions, and that could have been a whole talk. The whole idea about early alcohol use initiation and linked to harm, whether it's self-harm and addiction and other consequences, is a favorite topic of mine too, for prevention purposes. The normative age for drinking here in this population in the slums of Kampala are about 14 to 15. And so when I talk to people who are working in prevention and providing guidance and services, I really ask them to start about age 12 or 13 so that they miss that window, so that they have that, they've been empowered beforehand. It's almost like I planted that one.
Do you find that there are differences between the religious groups in Uganda with respect to alcoholism? I noticed that just looked up about 15% are Islam,
Yeah.
and the rest are some divide between Roman Catholic and Protestant.
So I think everybody heard the question is about, does the religious affiliations impact drinking? And yes, that's true, because there's a substantial Muslim population, and as with most Muslim populations, they tend not to drink. It's not always true, but tend not to drink. And so we see that when we look at variability across communities. We can actually even see that in terms of how many ads there are. And it's kind of strategic, right? You don't put a bunch of ads up if people aren't really drinking. So it's interesting how much you can learn just by walking around the neighborhoods and actually look at these things. So it's a really good question.
Monica, can you say a word about the larger context of how you got involved with this in relationship to alcohol and violence and HIV and the public health implications of that relationship?
So my broader focus area is really risky behaviors among youth and young adults. And so if we look at that window, say, 12 to 25 or 30, however we want to define it, there's certain key risk behaviors that really are harmful. Alcohol use, other substance use, alcohol use in itself is linked to high levels of violence, gender-based violence, other forms of violence and injuries, but also to transmission with HIV/AIDS. So actually the funding that I have been lucky to have for my projects in Eastern Africa has been the link between alcohol and HIV/AIDS. And the public health implications are really enormous. So I mentioned perhaps a little too quickly that there are very few people who are trained to do alcohol epidemiology or even alcohol research for that matter, really any alcohol research, which is why one of the big reasons why I'm there. It's tremendously fulfilling to be filling a gap that really needs to be filled. But the public health consequences of alcohol use of that magnitude spills over to violence, to injuries, to HIV/AIDS. And I'd be so bold to say that I think the fact that the trends are reversing in Uganda, meaning the levels of HIV and AIDS are actually increasing when countries around them is actually decreasing, is because of their high levels of alcohol use. And because of the risk, what happens when people are drinking and not planning and not using condoms, etc. There's also new research that talk about heavy drinkers having less of an immune system response, and at more risk for contracting HIV that way. So the public health implications of the alcohol use in and of itself is enormous. And again, we have not even talked about traffic crashes and all that. That's another topic altogether. But when I look at what the government is spending money on, and I even look at what our own NIH spends money on, because they spend a lot of millions of dollars on HIV, primarily treatment and adherence to protocols, there's very little on prevention and very little that is focused on alcohol use.
I have two questions. The first one is about the history of alcohol use in Uganda, whether it's a relatively new phenomenon in general, or if it's been a long time part of the culture there or in surrounding countries. And then the second question is asking for more detail about your work that does not involve surveying, that is looking at the built environment and the kinds of evidence there. I'm just curious, that seems like a really fruitful kind of forensic exploration.
Oh, interesting term, forensic. So in terms of the history of drinking in Uganda, I'm probably a little embarrassed to say that I don't have a huge trajectory here. I know that that drinking during the colonial days were different. So Uganda used to be under the British Empire, but since I think it was 1964, 1965, have been free. And so rules and regulations regarding these things have not been in place in the same way. And so I think drinking, the way it's so embedded in the culture, is really difficult to shift, and it's been high for a long time. Again, like I said, I really wanted to talk for hours because I could show you pictures about how many of the villages have their own alcohol production and they're very proud of it. I can talk about how it's very common to give alcohol to children to fall asleep better when they have toothache or when they're otherwise not feeling well, or how people drink alcohol because they have nothing to eat. Right, so the cultural references and the practicality of using alcohol as a coping strategy, etc., is really, really important. And again, can't go into all that in something like this. So we'd love to chat more about that. But your second question about sort of what we call the structural drivers or the environment is a relatively new interest of mine. And that is, looking at research done in other parts of the world, how structural drivers and how we have really made huge impact. I can mention, for example, something called CEPTED, or Crime Prevention Through Environmental Design, which is something that we have worked really hard on in the US. You can make some changes, lighting, make people look more accessible and visible, that you can change behavior patterns that way. They haven't really considered the built environment that way, but we're looking at that. But also, I really want to get a better understanding of the community dynamics without having to do household surveys and without talking to individuals. Because as all of you know who are researchers in the room, that getting the funding to do this kind of work and getting all the permissions and the ethical approval to talk to people is very cumbersome. If we can do a shortcut of sorts, and I can send out teams in the communities in like 20, 30-minute chunks, and they get a sense of what those communities are like and where we need to put our interventions, that would be huge progress. That's the short answer.
Are there any type of recovery programs over there that you're aware of?
Mm-hmm. So I think most people who say that they're involved in alcohol or drug use more broadly really talk about treatment systems. Now, of course, the healthcare system is really, really fragmented. So what we find are community-based organizations or non-government organizations really serving that need. That said, there are usually some cost involved, and not everybody has access to it because, again, the need far outweighs, spaces available. But there's a huge momentum in terms of pushing for more treatment availability, but also dealing with the stigma of seeking treatment. That's another one that is another burden to talking about alcohol and alcohol problems, is that there's huge stigma and that people keep it a private matter. That's not unique to Uganda. It's something that we see in many cultures, of course. But thank you for that comment.
So you focused on the children in this talk, but is it also the case that the adults drink a lot more in Uganda than other parts of Africa or other parts of the world? So it's really a whole social progress and pushing it down further and further, and the children just see that's adult behavior, for example.
Yes, no, I think that is true, and as we see with many other substances as well, is that children follow, in the adults' footsteps and sort of the culture and norms around that. The other interesting part of Uganda, which I didn't share, is that so many of them are abstainers. Right? So you have a relatively high population, maybe even about 40% at the time, that don't drink at all. So what that means that the rest of the population drinks so much more. So that skews everything too. And so as I tell my students, and I'm so glad to see so many of you here from my global health class, that we always got to keep track of the denominator. We always got to keep track who are in our analysis. And so are we looking at the whole population? Even they get such a high per capita alcohol use, even looking at everybody. But when we take out all of those who aren't drinking, of course, that changes quite a bit. So I always got to keep track on what we're measuring. It's a great question. Thank you.
Thank you. This was really fascinating. Earlier you mentioned that you were spending time catching up with your children after being in the field for 2 months. And just thinking about this series title, Women Inspire, could you, and thinking about who the audience is, could you talk a little bit about how you balance your various identities and the hats that we talked about in the introduction? Woman, mother, world traveler, researcher, instructor, faculty, friend.
Wow, thank you. I'm not really sure what to do with that one. My motto has always been work faster, work smarter, do more, but I think I hit a ceiling now. I don't think I can work any faster. But no, it's really, I think most of those of us who are women who are, choosing to have a professional career, who choose to be mothers, we always juggle this. And so I look at this, the last 2 years I've traveled quite a bit. And of course, I can tell that my children notice that I'm away. I have one here in the audience. But luckily nowadays, you can stay in touch so much more easily, right? You have Skype, you have all these social media ways to share pictures and to talk. And that, I think, really, really helps. Although as I have 3 teenage sons, not all of them want to talk all the time. And it's about respecting those boundaries too. But I think for those of us who choose to work internationally or in global health, as in my case, I mean, you make a choice. And, you know, people always ask me, I think I made the trip to Uganda 6 times this year alone. That's 2 9-hour flights, if anybody cares. And so I can't complain about that. That's a choice that I do. So I get on that flight and I deal with it. And I never really complain about jet lag. It's just something that comes with it. What's harder for me is that when I travel and when I'm away, it's harder to manage all the responsibilities here and there. And what I find is when I travel, so much of it is the briefings, it's the meetings, it's the networking to make sure that when I'm back here, all of those things are moving forward. So it's balancing in that way too. And it's about accepting conference calls at 6 a.m. in the morning here because of the time difference there. It's about 8 hours, and that shifts all the time. And so I don't know what my advice would be. I think perhaps the most important, you got to love what you do. I jump out of bed every morning because I don't consider this work. If I considered it work and it's like, oh, my boss told me to do this, it would be a whole different story. But this is what I want to do. And the interesting here is if you come and you work in a different country or a different culture in a different setting, they want me there. And this is so rewarding to do this. I mean, to be able to share this whole banning of the satch is something that we've been working on for years. It's like huge. I'm going to live on that for like the next 6 months. And so being rewarded and being refueled in that way, having the fantastic team to work with makes it all worthwhile. And I take my children to Uganda too. So it's not like they don't see that world. I mean, they know what I do when I'm there. And I go to other places too, but since that came up. So I don't know in terms of being inspiring. I don't know, I just think you got to love what you do. And then everything falls in place.
Thank you, Dr. Swahn. I just had a quick question in regards to wanting to know a little bit more about the why, but then you kind of touched on it when you said it was a coping mechanism as well as like a cultural norm. So compared to the lower tier classes with the slums that you work with, how does this look in the more affluent classes? And is it more of a social thing, or is it culturally inspired the same way, or is it also a coping mechanism?
So interesting, and I think I have to sort of answer that generically. I think for most people, drinking in excess really reflects a coping mechanism. It's a numbing. It's something to sort of take worries and stress away. My research in terms of in Kampala has really been with the poorest poor, and so I don't know in terms of the affluent, but what I can see sort of in social settings is a shift in terms of drinking more expensive wine among the affluents. Wine is not produced in Uganda. It's imported and probably costs 4 or 5 times as much as a beer does. And so drinking wine and sort of the finer imported liquors is really a status symbol. And I think, you know, sort of the Western values of drinking is also being now superimposed on original cultural traditions. And so it's a difficult question to ask or to answer. But I think these patterns are changing. They're changing just as we are changing, and as marketing are changing and really exacerbating many of these issues. But thank you, great question. Would love to have more time to talk about it.
Thank you. That was very interesting, and I wanted to ask you about the tension that might exist between research and advocacy. You drew a stark kind of line there, but it seems that clearly there is an impulse towards advocacy and policy change. And how do you negotiate that?
I think it's a difficult one, but I think in my case, I feel so strongly as a researcher. Not to say that I'm always objective. I really try to find my lens and really identify sort of what those buttons are. But I tell the people that I work with that I'm there to do the research. But I always talk to the advocates in the community-based organization, the government, and said, what kind of research do you need? Actually, I don't ask a question like that. I said, what kind of talking points would you like to have? What is it that you'd like to share with your communities that, you know, the issues that you may see? And then we work backwards from there. I said, if you want to talk about the extent of alcohol harm in your communities, well, then let's do a survey that we figure that out and we can give them those talking points. So I try to be really, really clear that I'm not the advocate. And in a talk like this, I don't know, maybe it comes across a little different, but I feel like my role is to produce the numbers and interpret the numbers and provide meaning to the numbers to those who need them, provide a context around that. Like I said, there are very few epidemiologists in this environment, very few people who do research in general. And so having someone to help translate and provide context I think is really one of the reasons why they value my work there. But I try to be very careful, and I know some professors feel very differently about that, but I feel like if I cross that line, I probably have compromised my integrity as a researcher. So I want to try to remain objective in that way. But great question. I think that's a lunch conversation too. So I want to really thank all of you for coming. I know it's a crazy week for all of us. Last week of class, Thanksgiving, post-holiday break, but I really, really value, you coming here and showing support, and I hope that we'll continue to have these conversations. I also want to call out Dean Erickson, who's always been so tremendously supportive of me roaming the globe and doing my thing and finding resources to support the whole enterprise. So I want to thank you publicly for that. And I want to say a quick thank you to my global health students for making it here. I'm really looking forward to continued conversation, and thank you for being a great class. And I think that's it. So thank you, everyone.
If y'all join me in thanking Monica one more time, I have a little gift, a way of remembering today and joining in this series. It really means a lot. Most of you probably don't know, but we really tried hard to have her in this series last year, but as she was jet-setting around the globe, I think you were, I don't know, with the UN or somewhere. So I was just so thrilled that she was able to commit to it this year, and then we realized she had the Fulbright. And so tracking her down has not been simple, but it's been phenomenally rewarding. So thank you very much. Really appreciate it. And I just want to draw attention. This series does continue. We will have 2 more in the spring. In fact, those ladies are with us. I'm gonna ask them to please identify themselves. Stand up. We have Ritu, who's in biology, a cancer researcher. She'll be up next, and then after her finishing the series will be Lene. She is our chair of the English department, and they'll be pretty amazing too. So do come back around. I know that many of you are friends of Monica's, but once you're in this series, you are always welcome back. So thank you, everyone, for coming today. Thank you. Oh, good.